Good afternoon. It's Saturday, April 11th, and it's been a week since I've done a data update. I actually want to do a slightly different kind of data update today because I want to react to a story that has been posted in the Seattle Times this morning. And so I'll get back to the regular data updates, keeping an eye on those things. It does look like Washington is doing all right. We're continuing to bring things down, although it's taking a long time to get rid of this virus. But the thing I want to talk about today is there's a lot of ways to talk about what our goal is in doing this. And some of those ways are easier to align with the data than others. One important way to talk about this is to say we're saving lives. That's a very good thing. I'm not speaking out against saving lives. But I want to say, when you say that you're saving lives, how are you saving them, and how does that line up with things like the scientific data? And I want to say it's not just about saving lives. There's a lot of well-intentioned things that are trying to get people to see the magnitude and serious nature of COVID-19. And I think that those have pretty much worked. I'm actually optimistically surprised by how we have responded as a nation to be able to socially distance so quickly and to be able to avoid the critical care crisis. One example of these is this is a picture that has a good effect, but it's not entirely true, okay? It says, would you still go out if you could see the COVID-19 floating in the air like that? And so I want to ask you, okay, the COVID-19 is magnified. I think that you should see atoms are really, really small, so this is incredibly magnified. In fact, if the virus concentrations were just like this, you would not be able to catch a virus because they'd be so small and widely dispersed. So what's missing from this picture? If you could still go out, if you could still see it, this is not a realistic picture because there's something very important that's missing. And so what I would say is missing is the humans that carry the virus are very important. The virus can actually be dispersed by droplets. It can be on a surface for a while, but I don't want to say it can live on that surface. It can stay intact on that surface, and intact virus can infect. So it can stay infectious, but it's even a question of, is the virus alive or not? So the humans that carry the virus are the most important part of this picture. If those humans are not around, there is a much smaller likelihood of catching the virus. Not zero, but also much smaller than if somebody, say, is in the area and is breathing out the virus. That's where you are more likely to get the virus from, to get an infection from. And so there's certain precautions that we can take, and that's why masks are such a good precaution. The other thing that's not in this picture, each human also contains an immune system that has many different branches that fight off the virus. We know that those branches aren't entirely working because we see the virus infecting people. We see symptoms. We see that we need to react and we need to do what we can socially to help our immune systems catch up to this. But I want to remind you that it's not just about this virus, and it's like a video game here, you know? You have these big red things and you're supposed to avoid the big red things, and if you can just avoid them, then you'll be fine. That's not the way it is, and it is okay to go outside into the open air if you take the precautions against the way the virus can enter into you, which is through touching your hands and touching your face, which is through breathing it in. But the virus is not like a video game where if you touch it, you die, okay? We've got to be able to have a more gray area way of looking at this thing, because we won't be able to completely get rid of this virus. Again, that's good news, bad news. We won't be able to completely get rid of this virus, but we might not need to if we change the right things to avoid it. So when we say we want to save lives, it is a very good way to talk about things if you're talking theologically or socially. If you're talking scientifically, there are some issues with interpretation. If the virus is not even alive, then what's the point? You're saving human lives is what you're talking about. And even the word saving, okay, saving means we're retaining, we're preserving. But scientifically, you know, the term is a theologically loaded term that we're importing into science. And I want to say, be careful about what you mean when you say, I'm saving lives by doing this. Technically, we're all dying every second, right? But there are certain things that we can do in a case where we have a horrible virus like the COVID-19 issue, that we can reduce that we can ameliorate it, and we can fight the virus. We are reducing death, but we cannot eliminate death. Reducing a virus, eliminating a virus is like polio. It takes 50 years. We have to figure out how we're going to live with this. I'm reminded for some reason at the end of Blade Runner where you have Edward James Olmos saying, it's too bad she won't live, but then again, who does? He's kind of talking about how life and saving lives, and nobody really is going to live forever. With that in mind, let's figure out how we can deploy all of our resources to make the most effect on COVID-19 that we can. And I think there's always going to be a little bit of slippage when you're talking about this. We're fighting the virus, but we can't eliminate the virus. We are turning down the disease, but we are not going to get to 0 deaths from any virus anytime soon. We need to fight against this, and I want to nuance what I'm saying at all times with this. But it's really important to note where I see things being, where I see the definitions of what success looks like slipping a little bit. So the one I want to point out, today's Seattle Times, the headline was this: more restrictions could be needed beyond the May 4 stay-at-home order to battle coronavirus. I am not commenting on the nature of that exact headline, but I'm going to point out something that I see in the article itself. The article does a really good job high up of saying what the real issue is. The real issue is keeping our healthcare facilities from being swamped by the outbreak and from saving every life that we can. But remember that the important thing first, healthcare gets overwhelmed, because if that gets overwhelmed, then we don't just have a problem with COVID-19. We have a problem with everything. So we are making the case for social distancing, and Governor Inslee yesterday, who, by the way, has head up a very effective response so far, and the distancing that we're doing is clearly having an effect. But then they have some modeling from the same place that I've been showing you models from, IHME, and the modeling says if we just lifted all restrictions immediately, then this virus would start to come back. That would climb back to about 15 residents dying per day by July 1st. Okay, we want to avoid that. So let's keep the restrictions in play. Nobody's saying that we take away the restrictions right now. So if we wait until April 22 and we start to take away restrictions, 2 weeks away, then deaths would drop, and then they'd climb to about 10 per day by July 14th. So this is what we need to calculate with, and we need to look at these numbers. But what's not mentioned in the article is how do these numbers relate to critical care capacity? If what we are avoiding is avoiding the hospitals being overwhelmed, would 10 deaths per day overwhelm the hospitals? And of course, I'm a journalism major from back in school. I understand that the article can't say everything. But I want to say that we had a subtle movement away from healthcare capacity being our main concern to the fact that there's any deaths at all from COVID-19 being the kind of thing that we want to avoid. We have to come somewhere in the middle of this. Remember that way back on March 12th, it feels like May 12th, but it's March 12th, I showed this graph, and I've showed this again and again, because this was the graph that was put out in early March, and it was the thing that said to me that we need to socially distance, and how will we be doing with social distancing. The important thing about this is I actually immediately recorded a video on that day because I heard the speech that came from President Trump. And President Trump talked about the deaths from the disease and how bad was the disease, what can we do about it. But the one thing that he didn't mention at all was the looming critical care crisis. And one of my points in the next video was like, we need to keep this in the center of our view. It's the deaths are one part of the whole picture. How it impacts our whole healthcare system needs to be our main focus of discussion. Because again, we can't afford to burn out our system and burn out our doctors and nurses in caring for these patients. So that was the whole thing. I wanted Trump to talk more about the critical care crisis. And in the same sense, when Inslee talks about what the shutdown has implications for, I want to keep the eye on the critical care crisis. We have a good model that so far has proven pretty successful in showing what's happening under our current circumstances with our current distancing. Now we can use that to look at the critical care crisis. How are we doing? And I want to remind you, in contact reduction, it's a percentage. It is not an all or nothing thing. Again, you can't completely eliminate your contacts. You can only reduce them. We can't completely eliminate this virus. We can only reduce it. And the question is, how much reduction do we need? We have these lines about 25%, 50%, 75% contact reduction. And I've shown these before, and I've said that, okay, now we are at the end of this graph. Which line are we following? One other problem is that this is a count of active infections. We haven't tested enough, and I'm not sure if it's possible to test enough to accurately count the active infections right now. So we have to say to ourselves, okay, we've got to use some imperfect data. What's the best imperfect data that we can use? And the best imperfect data, I've shown this before, is hospitalizations. Again, it's not even reported by King County, but it is reported by Snohomish County, and I've been tracking that. What I'm showing right here is the blue line is Snohomish County residents hospitalized on a certain day for COVID-19. And that has continued to go up, but it's also not overwhelmed the system. In fact, judging from the shape of this blue line, it looks to me like it matches the green line most closely. It looks to me like we were at 50% contact reduction, which when I said this on March 12th, I was saying that's about the best that we can do. So the good news is we're doing about the best we can do. Now note, for anybody looking to minimize this, the line is still going up slightly. Hopefully it's flattened out over the past week, but I've said that before and then it went up. Okay, so we can't say it's gone down until it's gone down. But it's been flat for the past week at about 100 patients hospitalized from Snohomish County. The other thing that I'll note is that the orange line is Snohomish County reported isolated at home with COVID-19. And that has also gone up. I've been watching that, and I've only been recording it, by the way, since the 23rd of March. So it actually was way down on the 23rd of March. But again, that's probably because of lack of testing rather than lack of virus. You see that it's gone up. Testing has gone better. We know a lot more people, and there's a lot of people staying home right now. And until we see this number go down, that's another sign that we should start to talk about, okay, what do we restrict, how, and when? We're not there yet until we see these lines go down. But at least this hospitalized line is not going up like the business as usual blue line on the line below. Remember, it's not even going up like the 25% contact reduction line. Honestly, these active infections, current hospitalized is the best proxy for active infections, and it looks like we're at 50% contact reduction. If there are places that we can relax, once that starts to go down, then we can relax and we can see that line possibly go up, back up a little bit again. That would be bad. We don't want that disease to happen. But the most important thing is to prioritize keeping the hospitals from being overwhelmed. Right now, this is flat. We need it to go down. The other thing is that we have the IHME model for the entire U.S. and for Washington State. And I remember being not sure that this model, feeling like this model might be a little bit too optimistic. But then again, as it's played out, the lower bands of this model's predicted error are what's been happening. So the good thing has been happening. The model has been accurate and, if anything, a little pessimistic. That's what I want my models to do. This came out on March 25th, and it predicted that there would be a peak of 27 deaths on April 21. But then, of course, I collected more data and I plotted it on top of the model. The red line is the model. The blue dots are the current deaths per day. I get my data slightly differently than they get their data, but they get the same data, they plug it into their model, and they update their model. Again, this is not this is not the kind of model that makes a huge prediction, but it sort of takes the velocity of what we're seeing and projects that out. If things stay the same, what's going to happen going out? And it's really important to say this is what models are good for. Models are not good for telling the future in general, but they're good for telling the future if we know enough and if we keep doing thing X or thing Y. So with all that in mind, with the social distancing going on, you can see that the data is really scattered. Data will be data, and they'll be noisy, but it's going up and down around that line in the middle. And this is where they updated. I showed this last time when we had April 2nd. And you can see that if you compare the red lines, the red line is calming down. It's going down, and the lower end of the red line appears to be, the lower end of the red line here is what we are closer to if you follow how the data went up. And this is the most recent model, and you can see that the line has continued to go. In fact, I want to point out, if you look off to the left, it says 5 days since projected peak in daily deaths. According to the model, well, with the uncertainty, we're right around the peak right now. But according to the way the model is fitting the data right now, we are actually past the peak in deaths for the whole state. That means that it projected 42 deaths. You can see that within the noise there it was. But it looks like this is going, I want to go back and forth again. You can watch the model sort of calm down from this. Watch the red line. It's calming down, and the red line's calming down a little bit more. Look at the current stay-at-home order. It expires on May 4th. By that time, the model is predicting that we are going to be on the tail end of deaths. This is assuming that we keep up the social distancing, and it looks like we should keep that up at least through May 4. But it also looks like we will be well past the peak by that point. If the data continues to follow this trend, then we can talk about which part of the restrictions do we relax. How do we keep on the line of 50% contact reduction? We'll be able to go, at some point, we'll be able to go back up to 75% contact reduction. And then we might have to go back down to 50% again. It's a question of not shutting everything down or letting everyone run around. But what's the safe way to deal with this? And some contacts are unavoidable. The green line on the ICU model of the IHME model is going to be the ICU beds available. That's the most limited resource. And we want to make sure that we're staying under that. And you can see within error, the green line is sort of coming right up against that. You know, again, it looks like we've played this out about as optimally as I can imagine, because our healthcare capacity is able to take on this stress. But there are other stresses. People aren't getting vaccinated now for other diseases. People aren't coming in for their doctor's appointments that might catch another problem. So the healthcare system is still stressed. We need to figure out how to unstress it. We need to figure out how to keep our contacts down so that the healthcare system remains unstressed. But I want to say our top priority, and this is a repeat of a slide from previously, our top priority is avoiding a surge. And we might have to answer these questions with local data. Notice I've always talked about Washington State here. Washington State is the unit by which our governor is deciding whether we should stay home or go out. This will play out differently, and it has played out differently in different states. California, it's played out pretty well. New York, it has played out tragically. But now San Francisco is sending doctors to New York to help them with that. The good news is this is not playing out the same way at every place in the nation. We've got to let individual governors look at individual data and individual projections, not just of deaths, but of clinical care crisis indicators, active infection indicators. And so we need to keep doing what we're doing. We need to use a mask when you go out, when you go into the grocery store. Go ahead and do that. It's a good thing, and it can't hurt. You don't have to wear a mask when you're outside under the clean air and 10 feet away from everyone. That's probably not going to have as much of an effect. And I've said that we need to survey the population with antibody tests. Note what I said. It's really important. Survey the population. Antibody tests are 95% accurate, which sounds great until you realize that they're going to get stuff wrong 1 time out of 20. If you're using them to make individual judgments or hand out antibody cards, I don't think that they can do that accurately enough to be able to know. We have to know what we know and know what we don't know. And I think it's problematic to propose an antibody card to say this person's immune. Respiratory viruses don't work like that. But it can tell us how much of this has gotten out in the community, and then we can make decisions based on the group. And we have to consider that there's this whole philosophical issue of balancing between the group and the individual. And we're running into that right now with our legal proclamations regarding this. So look at the details. I've just heard that Texas is looking into relaxing restrictions. It seems to me like that's too soon. But I didn't see any details about what restrictions are going to relax when and on what basis. What I would love is to be able to set an actual critical care crisis related metric that says, okay, when we hit this metric, when we see this number going down, then we will relax this way. And then be able to modify that as we go. But it'd be nice to have some, if we're going to be data-driven, let's be data-driven. But let's focus on the important data, and let's not expect to be able to bring deaths down to zero. This is going to be, we might even be able to bring a particular category of deaths down to zero. But all the other deaths are still going to go on. We've got to realize that there is a gray area here with contact reduction and with the question of what activities do we want to allow as a community. Let's talk about those carefully without polarizing the other person into, oh, you just want to shut down everything, or, oh, you just want to let everyone run free and let the virus kill people. We're all in the middle here, and that's the important thing that I want to say. Let's look at the data that reflects active infections. Let's compare it to the hospital system. And we're in a big world. There's a lot of countries and states trying different things. And so if they're going to be trying different things, let's watch them. All along I've said, let's watch South Korea and let's try to bring our curve down like that. Washington brought its curve down like South Korea did. California probably did the same thing. And now we have some countries that have brought the curve down, and they've decided to start reopening. So we're not alone in this. We can look at how Austria goes. According to this story, on April 14th, they're going to start to reopen. They're going to let small distance sort of stores be able to happen. And then they're going to have larger ones on May 1. This is good. We'll be able to see how it plays out. I think this is going to be okay for them. I don't know until we see the data. And so I just want to remind you, with all these things, we do want to return to the data. But all the data are messy. All the data are imperfect in some way. They're collected by human beings in complex situations. There's always going to be noise. There's never going to be elimination of death, not until the promises made in Easter are brought to be true. And that's not going to be by our effort. That is God's job. And so I just want to remind you, death is still the enemy. This virus is still the enemy. I'm comfortable with using that language. Let's remember that there's lots of enemies out there. And let's remember also that we have some allies on our side. We have immune systems. We have science to be able to collect the data and see how it's going. So let's look at that. Let's tell the truth to each other. And let's say, when I look at this data, hospitalizations are flat. That means they're not going up. They're also not going down. That's the truth as reported to me right now. And let's not try to tell each other the truth that the other person needs to hear, to like shape it or spin it. Let's talk about the real complexities with the truth, and where we don't know, say we don't know. Not assume that the glass is half full or that the glass is half empty. That's an interpretive thing. The glass is 50% volume occupied. Okay, how you interpret that is the next step, and that's up to you. All right, so thanks for listening to this. There was some good updates. I'll continue to keep an eye on it. And for now, as the updates go, let's keep distancing and doing all those things. Okay, so I'll hope to talk to you next week about, and hopefully we'll continue to see the data look better next week than it did this week.